from Nucci Medical. Thanks for joining us for our coffee talk. And again, I do have my coffee. I almost forgot my coffee. So fortunately, I have my coffee is now changing colors for some reason. Anyway, but it's still very good. Thank you for joining us for today's coffee talk. Sorry, I didn't shave this morning because I was in surgery this morning. I tend to shave when I do surgery. It's another coffee talk maybe. In any case, today's talk is on ED, or potentially ED, after spine surgery, erectile dysfunction after spinal surgery, or from spinal surgery, or spinal injury of some sort. Well, from the surgery standpoint, it is not common. It is not common with spine surgery to have any type of ED as a result. One of the concerns that we do have that we tell patients about and help patients about is retrograde ejaculation, actually, from a spine surgery from the front when you're working low on the spine, the lowest part of the spine. Not super common, but it can happen, and if you're trying to have children, it could be an issue there. So we warn patients that is certainly a possibility, although not likely. That's really from the front because the nerves are essentially in the front that cause that kind of problem. From the back, going from the back, the spine, making incision in the back, and going from the back, not really an issue. Now, the nerves that are involved here are in the areas that you are operating on. So it is theoretically possible that you'll have ED from spine surgery in the low back, just from any kind of surgery. But it is, very uncommon. But people do ask about ED and ask if that can happen. Some patients also ask, I have an injury in my low back and I have some erectile dysfunction, and is that the reason? Or bladder problems of some sort. And generally the answer is no, it's not. And if someone has that complaint, even after an injury, you should look into the other causes of it first. Other causes, urinary problems, other causes of ED problems, other causes. Look at that first and make sure that that's not it. And then the ED from spine injury becomes almost a diagnosis of exclusion. And then if you operate on someone, it may not improve. Often there's a pain issue involved with ED. So if someone's a lot of pain, it does affect patients, and that can be a cause of ED, just the pain itself, or the pain after surgery. But from a physiological standpoint, from actually injury to the nerves themselves, not really a cause of it, more of a pain issue. But as I mentioned, the retrograde ejaculation for men who want to have children could be an issue. Happens occasionally. There are ways to do surgery to prevent it. When you go from the front and the lower level, that does become an issue. But the short answer to this is not common. And if it does occur, it's often a pain associated with pain, because a lot of pain will affect it, not really a physiological or nerve injury. And if you have that kind of problem from a spine injury, you start to, a low back injury, I'm talking about not a neck injury, which can paralyze you, of course, but a low back injury, it really doesn't do that. It's more of a pain situation than a physiological situation. And presumably, if you control the pain, you'll improve in these problems. So it's not a very long coffee talk; it's a short coffee talk, but it's a question that I'm asked, and I think people need to know that not to worry about it, but certainly you can ask the surgeon who's taking care of you to see what their experience is, but it's not common. That is a quick one, but I hope I have a couple of interesting questions to be asked that I can expand on this very interesting topic. Let's see if I can read the question here. Oh my goodness, what are the other complications of spine surgery? Well, there certainly are complications from surgery in general, and spine surgery, in particular. Well, when you operate on someone, there's always the complication, I suppose, the complication that whatever you were in spine, usually it's a pain issue, but whatever you're trying to fix doesn't get better, so the pain doesn't improve. The nerve may be injured before you get there, and so on. So there's no improvement. But But generally, when you're dealing with spine surgery, you're dealing with some of the standard complications that you would see with surgery in general, which would be bleeding, extra bleeding, and we try to do things in smaller incisions to prevent the bleeding. Nerve injury, certainly in the spine, you have nerve injury. I alluded to earlier that paralysis is more of a neck issue or upper back issue, because that's your spinal cord is in that area. By the time you get to the low back, spinal cord stops and it's just the nerve sort of hanging down there. So you can get a nerve injury more in the low back, but up in the above that where the spinal cord is to the neck, you get a spinal cord injury, which is both sides. A nerve injury tends to be really a one-sided thing. You're one nerve, it goes to one side. But certainly there's nerve injury, paralysis. We worry about this. So fortunately, extremely rare. One of the things we worry a lot about, of course, and as a complication of surgery, is infection. So we have to do antibiotics and do things to make sure infections become less likely. But ED or retrograde ejaculation, not a major complication, and I do not mention it to patients generally, unless we're operating in certain areas of the low back. Then we'll mention it at that time. Of course, with neck and paralysis, it would affect everything. We do mention that too, of course. So that's one. Let's see if there's any more questions on ED questions. Another ED question. Okay. Can you have emergency spine surgery if you're pregnant? We're going way out on the line here. It says so no longer ED. Now we're into pregnancy. Can you have? Well, if it's emergency, it's an emergency, right? It's emergency spine surgery. You get an accident, emergency. You have to be fixed. We don't like to operate on patients who are pregnant, of course, unless you're being a C-section or something, or some other OBGYN type of thing. But from the spine surgery standpoint, we don't operate on patients who are pregnant. Actually, we test people if they're pregnant. One of the reasons why we do that is the stresses of the surgery can affect pregnancy, but also the medications they give can affect the pregnancy and cause problems. And the x-rays that you may use can also cause problems. So we won't want any of those things. So the answer is, if there's an emergency, you do what you need to do to fix it. That would be a true emergency, a life-threatening emergency, a car accident, a fall, some type of thing. Then you do what needs to be done. But generally, you avoid pregnancy. Obviously, maybe you want to avoid pregnancy too. I don't know, but you have to avoid certain surgery if certainly elective surgery if you're pregnant. So that's sort of a side to ED. There's ED over here, and then there's pregnancy issue. Different question. They don't usually go together, actually, but that's nice we were able to talk about that too. I think that may be the extent of our question. Let's see if there's anything else. But these are. I think the important thing is that you're asked these questions, which is why I'm bringing it up now. And there are no dumb questions. So say, it couldn't possibly. Ask the question. I mean, there should be an answer. You should be able to get a straight answer. And if the surgeon that you're taking care of you, I mean, I know the answer right off, but can find the answer and let you know. But usually they have an answer to most questions. But you should ask these kinds of questions and have them explained to you to the extent that you are satisfied with the explanation, so you are informed and can go forward with information and make the best decision for yourself in that regard. So ED, not a concern generally. It's unlikely, it's rare, and I've never actually seen it in my practice. But I do have people who've mentioned that I'm in a lot of pain, I have an issue, an ED type issue. That has happened. Generally, if somebody says that, we try to treat the underlying pain source. We would refer them to maybe a urologist for evaluation and treatment if that's a concern, and they can be treated for it. And I think that is it. I think it's about maybe a few minutes early for our coffee talk. As always, thank you for joining us. Any questions you may have about what we discussed, or something you'd like to hear about, like this question, something you'd like to hear about, I'd be happy to write it down and address it in a coffee talk. And if it's a big topic, we may do a bigger webinar on it that we do occasionally too. Thank you all for your time here, and we'll see you next week.